I'm sure enough more and more of the people of Utah will be walking around with these masks on to help protect them from the spreading and catching of the coronavirus. So to have you here, it's still a difficult in getting on board and providing help. Our private sector is stepping up in a significant way to help provide materials for additional testing, for materials for PPEs, personal protection equipment, those involved in the medical sector of our economy doing a yeoman's job in helping people. We appreciate that work. We're very concerned about those who are infected with the coronavirus, COVID-19. For those families that are impacted, our hearts break for those who've lost. Everybody is working around the clock as hard as we can to find a way to mitigate this spread and to get back to normalcy. And speaking about that, I'm also concerned about those whose livelihood, and we'll talk a little bit more about that. I have on my lapel here a white ribbon. That's to show our, and again, let me just emphasize those people on the front lines, those that really are on the front lines, and those who've been doing this since January. If you recall, it was not declared a pandemic. Until I think about March 11th by the World Health Organization. These folks have been involved, have been very engaged. They're on the front lines. Even as we're working to help mitigate the health issues for the individuals and throughout our state, as we face this significant crisis, we are also simultaneously working to see what we can do to mitigate the accompanying economic crisis. I've said before, and people try to, for probably different reasons, act like we only can care about one and not the other. It's all about health care, or it's all about economic opportunity, when in fact they're both joined together. We are working on both of them simultaneously. And some good news, I mentioned help was on the way. For those involved in business and the economics, employers and employees that have need for help at this current time. We're in really a crisis time economically. As I've mentioned before, we've had in the last 2 weeks almost as many people apply for unemployment insurance than we had in the entire year of 2019. That shows a significant drop in employment and a significant rise in unemployment, which we're trying to help mitigate. So with Congress on March 27th and the President then signed into law the $2.2 trillion CARES Act. And it includes nearly $350 billion for small businesses. Now, small business is defined as those that have less than 500 employees, but it accounts for 90% of all the business in Utah. So most of the business, 90%, is small business in Utah by definition. And the backbone, really, of our economy is, in fact, small business. Along with this $350 billion for small business, Congress also expanded the Economic Injury Disaster Loan Program, which provides businesses with up to $2 million in working capital. These are loans that can be obtained by businesses that are having impacts because of the COVID-19 or in distress. We also have the ability for businesses to apply directly to the Small Business Administration. And whether you get a loan or not, just by the act of applying for the loan, you're going to get some immediate help in the amount of $10,000 payment to use for some of your needs. This is to grant for immediate expenses or past due bills. But just by applying directly to the SBA, whether you get the loan or not, you're going to get a $10,000 stipend to help you with your expenses. That's a pretty good deal. The CARES Act will benefit Utah businesses and individuals, employers and employees, as I've said, with loan and grant programs. It'll help you with significant corporate tax adjustments. direct payments, and increased unemployment insurance. So the benefit to business and employees are significant. For additional details on these programs and others, please go to coronavirus.utah.gov/business for additional details on these programs and other resources and opportunities as we try to mitigate the effects of this pandemic. Let me emphasize just this. The most important program right now for every small business in Utah is to be aware of is what we call the PPP, the Paycheck Protection Program. The Paycheck Protection Program will cover payroll, rent, mortgages, interest, utility payments for an 8-week period of time for just about every business that we have here in Utah that has less than 500 employees. So it is universal in its application for the business people of Utah. As long as businesses keep their employees on payroll and use the loan for operating expenses, the PPP loan will be forgiven. So again, the federal government is stepping up in an extraordinary way to help businesses stay afloat, really to navigate these troubled waters, to get through this gap from a very great economy, now some troubled times, to when we get back into recovery. So if you are a growing Utah company with less than 500 employees, this program is for you. If you run a small mom and pop shop, this program is for you. If you do contract or freelance work in any industry, this program is for you. And if you are a local franchisee or of a restaurant or a hotel, this program is for you. It's going to help you get through the troubled times until we have a recovery. Applications open for small business and charities were opened last Friday, but sole proprietors and independent contractors can apply starting this Friday. There's opportunity. I'll just mention Majority Leader Mitch McConnell has said anybody who qualifies for this loan, we will have money available for them, even if we have to add some additional monies to the programs already provided for. So you don't have to worry about not being able to get the money. It may be some time to go through the application process. But the good news is the federal government is saying, at least Senator Mitch McConnell is saying, we will add additional money so that anybody who qualifies can, in fact, get one of these loans. That's good news for the economy. If you're starting today, here's what you ought to be doing. Reach out to your lender to begin the application process for your PPP loan. Most lenders are involved in this, but if your lender is not participating in this program, if you don't have a lender, then go to coronavirus.utah.gov/business and you'll find a list of those participating banks and financial institutions which are involved in processing PPP applications. So my encouragement, my call to action, really to help us with the economic recovery as we move from urgency, hopefully into stabilization. This will be part of our efforts for stabilization, is for every Utah business with less than 500 employees that has been impacted by COVID-19 to apply for a PPP loan, an emergency disaster loan, or both. There's not a limit there. You can actually apply for both as soon as possible. And I recognize that lenders are working around the clock to try to accommodate the many people that are applying for the loans and more yet to come. So we appreciate the work of the lenders and the financial institutions, credit unions, et cetera, that are doing this work. And we appreciate also the fact that some of these institutions are taking on new customers because the person's maybe bank that they normally do business with is not participating in the program. Other banks are going to have to take on some additional customers, and we appreciate the fact that they're doing that for the good of the whole, making sure that we have every business has an opportunity to have access to some of this money to help them recover. So let me just again say thanks to everybody that's involved in this. Again, I appreciate the fact that our private sector is stepping up in so many different ways. We want to make sure that we do everything we can to help them survive the troubled times and to come back stronger and healthier than ever before as we start the fall part of this year and going into 2021. So with that, as I just emphasize that small business really is the backbone of the economy. We want to take care of them as they take care of their employees. The help is on the way. To help us understand this maybe a little bit better, I've invited Derek Miller, who is the president of the Salt Lake Chamber of Commerce and is the chair of my Economic Response Task Force, designed to try to help us look at all the issues that impact the economy today in this unique and uncharted time, and to see what we can do to come back healthy as the best performing economy in America, which we were before the pandemic. And so our goal is to come back to be number one in the future. And Derek's going to help us understand better how we can do that. So, Derek, would you like to take the podium here?
Good afternoon. I'm Derek Miller, president of the Salt Lake Chamber and Downtown Alliance, and also serve as the chair of the Utah Economic Response Task Force. Thank you, Governor. Thank you for convening the task force 3 weeks ago and for being focused on a balance between life and livelihood, both the healthcare imperative as well as the economic imperative that we all face. I want to repeat for emphasis the governor's call to action for every small business in Utah, those with less than 500 employees. As the governor said, 90% of Utah's business community that has been impacted by COVID-19 to begin the application process for the PPP loan. As a business community and as an economic task force, we recognize that the most important thing that every business can do to help get through this crisis is to follow the restrictions that the governor has put in place in order to stay safe. We also recognize that the most immediate thing that each business can do to support the Utah economy is to begin applying for these loans. This will provide the capital to businesses so that they can pay their employees, so that they can pay their rent, so that they can pay their other operating expenses. And this capital will flow throughout the economy as the fuel that keeps our economic engine running. The Economic Task Force was created, as I said, 3 weeks ago by Governor Herbert, and it consists of leaders from both the business, the private sector, and the public sector. The task force has outlined 3 objectives. The first is to consolidate, to curate, and to communicate business resources. Those resources exist at the coronavirus.utah.gov website. The second objective is to identify, assess, and make policy recommendations to all levels of government, our congressional delegation, our governor, legislative leaders, and local governments. And the third objective was to develop a statewide economic response plan, which the governor unveiled just a few days ago, the Utah Leads Together Plan. That Utah Leads Together plan identifies federal stimulus as one of the most important ways that Utah citizens, employers, and the overall economy can get through this pandemic, and especially and particularly through the urgent phase of the plan. The task force met this Monday, and as we do at each meeting, we asked ourselves, what deserves our immediate attention right now? The resounding answer to that question was what you have heard today: to get every qualified Utah business to apply for a PPP loan. The task force also recognized the need to support the many very small businesses through this process. Under normal circumstances, small businesses work every single day to keep their head above water. But we are certainly far from normal circumstances. So the need to provide technical assistance to these very small businesses is great. To provide this support, the Economic Task Force is working on 3 fronts. First, we are coordinating with the Eccles Business School at the University of Utah to provide an online seminar series titled How to Save Your Business. That series is hosted by former Governor Mike Leavitt and is focused on very specific and practical information. Number 2, we have developed a list of the federal programs that are available to businesses and also lists of frequently asked questions for each one of those programs, including the PPP loan that we're discussing today. And number 3, we have established a rapid response team. to help Utah businesses in answering their questions and troubleshooting problems related to the loan application process. The rapid response team is staffed with more than 50 volunteers from 20 different Utah organizations. Since they launched at the end of last week and just over the weekend, they have helped more than 600 very small businesses. Their volunteer work is incredible, and I thank them for it. I want to stress once again that all of these resources are available, as well as access to the rapid response team at coronavirus.utah.gov/business. Thank you.
Thank you, Derek. Let me just again mention the importance of the private sector. Again, Derek and his task force represent the private sector. Government can't do this all by themselves. It really does take the private sector stepping up, and they're doing so in a remarkable way with additional testing opportunities coming from the private sector, additional PPEs, protection equipment coming from the private sector. We have, in fact, companies manufacturing have changed their line of manufacturing to produce additional personal protective gear for us to help us through this time. So the private sector is stepping up. Apple just gave 100,000 rather masks for us to be used for our health care providers. So again, I appreciate the work of the private sector, and Derek, your efforts on kind of steering that together. So we have this public-private partnership, really an all-hands-on-deck effort to help us slow the spread of coronavirus and stop it and continue to have economic opportunity. So with that, we have a few minutes before we bring out our epidemiologist, Dr. Dunn, to give her report. Any questions that you have out there for a couple of minutes?
Hi, how many people in Utah do you want to test total, and like what percentage of the population for COVID-19?
That was a little loud. Somebody tell me what she said. How many? We'd like to test everybody. The question is, how many would we like to test of the population? We'd like to test everybody. We don't have the capability of testing everybody. We would like to test to make sure that there's no backlog of people waiting that have symptoms. So we have a screening process that we go through, and those that have symptoms can make arrangements then to come and get a test. We have the ability to do that with virtually no backlog. We're having a much more, I think, success giving the test. The challenge we face right now, to me, is a little bit on the laboratory side, where we have a little bit of pinch points. The laboratory can't keep up with the tests that are being given. So we're a little concerned about that. We're doing probably between 3,000 and 4,000 tests a day. At least we have the capacity to do that. We'd like to get up to, as I've mentioned before, 7,000 tests a day, which will be a good number to make sure that all those who really have any kind of symptoms will have the ability to be tested. If we do that, we can find who they are, isolate them, and hopefully slow the spread, be more surgical in how we track and trace people, which again helps us isolate and slow the spread, in fact, stop the spread of the coronavirus. Nick, are you there?
I'm unmuted now. Can you hear me now?
Yes.
All right. It is such a scary and confusing time for small businesses. Can you clarify, if any business applies for a loan to the SBA, they get, is that $10,000? What is your message to small businesses who maybe don't have employees and PP loan may not be applicable, perhaps, but that $10,000 sure sounds appealing if you're a small business.
It does, doesn't it? So I'm going to let Derek amplify that a bit. And so Derek, you come over.
The answer, Nick, is yes, that every small business that has been impacted by COVID-19 can apply for both loans, both the emergency loan as well as the Paycheck Protection Program loan. You can apply for both. What you cannot do is use money from both for the same thing. So you can't pay your rent and then use another loan to pay your rent. You've got to use the different loans for different purposes. The second answer to your question is yes. under the emergency loan, because the entire country now has been designated as a disaster area, all small businesses that have been impacted can apply, and they will get an advance of $10,000. You also mentioned that some businesses don't have employees. Every business has at least one employee, even if it's just the sole proprietor. And this program allows sole proprietors, whether you work in the gig economy, whether you're an independent contractor, none of those groups are excluded. So if it's just you and you've been impacted, you can apply for the loan.
Thank you, Derek. Again, this is really, really good news for our business community. And so we hope everybody takes advantage of the opportunity. Again, the good news is, according to Senator Mitch McConnell, the Senate Majority Leader, that they're going to provide enough money for those who qualify to make sure that they get a loan. They won't run out and somebody gets left outside in the cold while others get the loan. So that's good news for the business community. Next question.
Hello. Last weekend, there was an article in the Daily Mail, an English paper, that spoke about hotspots in America, people fleeing from them to other places such as ski resorts. And Park City was mentioned as a place where people such as from New York were heading to. We talked last week about preventive measures of either quarantine people coming into the airport that are non-residents of Utah, or just basically saying, hey, please don't come to Utah, as well as issuing some checkpoints on the roads for non-commercial drivers. I wanted to find out what type of progress has been made on that, because again, that just seems first thing we should have done is secure the perimeter. So again, it's very important, I think.
Thank you. Clearly, the challenge we face here in America is stopping the roads. So coming into a state, having checkpoints is maybe one thing. Stopping them from coming in is another that has some logistical problems as well as some cost. If you have to put somebody into quarantine for 14 days, where are they going to go as they try to come into our state? Who's going to pay for their quarantine arrangements, whether that's in a hotel or some other accommodation? But we've worked with our Commissioner of Public Safety, Jess Anderson, also working with our former Adjutant General, General Jefferson Burton, who's taking the lead for our health care and the Department of Health. As both of them are working, we are talking, in fact, about what we can do with the Salt Lake International Airport, what can be done to, in fact, screen people that come in. Obviously, we don't care about people coming into the state if they're not infected, if they're not going to spread the coronavirus. So the ability for us to screen these people is probably more important than anything else. I have not heard that people are wanting to come to Park City as a place, because that's been one of our hotbeds of having infection. In fact, the rate of infection there has been higher than some parts of our state, and they've put in some significant control measures to stop that from happening in Summit County and Park City area. So those issues are on the table, and we're going to take a look at those. We may have some more information here in the next day or two on what we're going to be doing on travel arrangements. Next question.
Yeah, the governor, yesterday Salt Lake County's mayor suggested that there's a possibility some of these health orders remain in effect through as long as Memorial Day. Is that what what state modeling is showing? Is that what you're anticipating? Is some of these restrictions being in place that long?
Well, the modeling, which has been somewhat a little bit erratic, I think, as we look around the country. I know our state epidemiologist, I think, talked a little bit about that yesterday, but the modeling coming out of the University of Washington showed a much higher infectious rate and casualty rate in the state of Utah than we're actually experiencing. So they've, in fact, reduced those numbers. So I'm a little careful about modeling. I am really more concerned about what is actually happening in real time. We have 13 deaths, which is 13 too many. But it's certainly a far cry from what the modeling had showed before. And I know they've revised their numbers down from, I think, close to 900 by the peak time of this season, which they predict probably the latter part of April and maybe into the middle part of May. Now they're down to 186, which is still way too many. So I'm more concerned about making sure that our data that we have here guides our policy in the state of Utah. I think we have some hopeful signs with the data. We're going to have some more information to roll out here in the next couple of days on data points and what we're watching. Clearly want to make sure we understand what the transmission rate is, how many people are in fact infected out there, and are they getting treatment? Our tracking and tracing, which is something that is very important. Our hospital ability of our hospital healthcare system to accommodate those who have the infection. I feel very good about where we're at with our hospitals and our ICU bed space and what we have accommodations there. And we ought to see, you know, if we're in fact getting to a point where we see reduction. And if we have a reduction in the rate for 7 to 14 days, that's maybe a time for us to loosen, not tighten, and help with the economy. So all these data points are important for us. There's a lot of work going into trying to discuss and analyze the data to tell us what we should be doing for policy. And again, I'll just emphasize it is important for us to keep our social distancing programs and protocols in place. We should, in fact, avoid gathering together in groups. We should, in fact, make sure that we don't do any travel other than what's essential and necessary. I note that we have a holiday weekend coming up again this weekend. And so I would encourage Utahns to find ways to stay home and enjoy the peace and quiet of your residence. The safest place you can be is home. Stay safe, stay home. Only essential needs and travel should be accommodated. And again, this is a sacrifice. I understand it's hard, particularly for some of our young people. They use this for spring break time and have a propensity to want to gather. I understand that, but you can't do it. You shouldn't do it. And again, if we all cooperate in this effort over the next couple of weeks, we can get ahead of this and start loosening things up and going back to normalcy. Not going to be in one fell step, but in multiple steps as we move together on this effort. So I'm hopeful, I'm optimistic, and we'll let the data drive our policy. With that, we thank you for your time today, and we'll see you again tomorrow.
We'll now have the opportunity to hear from Dr. Angela Dunn, our state epidemiologist, and she'll be able to take your questions following her presentation. Dr. Dunn.
All right, good afternoon. I'm Dr. Angela Dunn, the state epidemiologist for the Utah Department of Health. Today, we're reporting 1,738 cases of COVID-19 in Utah. That's an increase of 63 from yesterday, or a 4% growth rate increase. We've tested 34,647 Utahns for COVID-19, an increase of 1,253 from yesterday. So as we've been saying for the past couple of days, we're not relying on individual days' numbers. At this point in the outbreak, it's really important to look at 2-week trends. However, what has been consistent is that we've consistently had a 5% positive rate of all of those people we have tested. We don't really have hard scientific evidence as to why this is, but we do know that we've brought on more labs. And no matter if we test 1,200 a day or 3,500 people a day, we still are consistently at a 5% positive rate. And this is a lower rate than some of our surrounding states. And it could be because we implemented social distancing measures really early in this outbreak, such as school closures and in-house dining for restaurants and bars. However, what we need now, and what Governor Herbert mentioned earlier, is that we need a drop in actual cases to happen. And in order to do that, we're relying on you as individuals to adhere to the stay-at-home directive by Governor Herbert so that we can see the low testing rate, the low testing positive rate translate into a lower number of cases every day. Okay, with that, I'll take some questions.
Yes, Doctor. We heard from the University of Utah that he hopes that within a week there could be better testing for antibodies to see if more Utahns have actually developed it. to fight against coronavirus. And maybe within a month, we might be able to figure out how to use info from that testing. Are you seeing kind of the same kind of optimism when it comes to antibody testing in Utah?
Sure. So antibody testing is a really important aspect of any pandemic or outbreak response. It allows us to determine who has been exposed and who potentially has immunity to COVID-19. Those tests are still in the development phase. The CDC is working to develop a serology or a blood test to determine if somebody has antibodies to COVID-19. And I know locally, ARUP is doing something similar. So we are hopeful that within the coming weeks, we will potentially be able to use this test to determine who in our population has been exposed to COVID-19 and who potentially has immunity to it.
Hi, I'm wondering if you could clarify something that the governor said earlier. I wanted to ask him this, but I guess I can ask you. He said that when asked about testing, that it's actually the laboratories that came up with the tests. And correct me if I'm wrong, I think you said the opposite of that yesterday, that the labs have a higher testing capacity than we have testing supplies for. Can you clarify which one of those is correct?
Sure. So I missed the first part of your statement. Right now, our laboratories, in collaboration with ARUP, Intermountain, the Utah Public Health Laboratory, and our testutah.com partners, have a capacity around 4,000 to 4,500 tests to run daily. We have not met that capacity yet, and so people who are symptomatic can seek out testing, and if their provider thinks that they are an appropriate person to be tested for COVID-19, we do have the capacity to test them. Our local hospitals and laboratories are potentially worried about a swab shortage. However, we're working very closely to try to secure more swabs so that that barrier will be eliminated and people can freely get testing if they do have symptoms.
Hi, how many people are in the hospital with COVID at any given time, and how long is the average stay?
So currently we just have total numbers of hospitalizations, and we are at about 8% of everybody who's had COVID in Utah have been hospitalized. We are working with our hospital partners to understand who's currently hospitalized for COVID-19. And so we're hoping in the coming days, if not this week, next week, we'll actually be able to understand who is currently hospitalized with COVID-19.
Yeah, I have a question about false negatives. Do we know what causes those false negatives? And do we know anything about how common they are and how much that skews our statistics?
So the false negative rate in the testing that is done throughout the labs here in Utah is very low. It does rely on detecting RNA from the virus in a specimen. And so it is a very accurate test. We are treating every test result we get as a true negative or a true positive. And so I think that it is a reliable test at this point in the outbreak for those who are showing symptoms and have a reason to be tested.
Thank you. I read some articles in the Italian press about there's some physicians that are encouraging treating the COVID patients outside the hospitals like in ancillary facilities because it just, to their opinion, they just said it was spreading so rampant and there was nothing they could kind of do to prevent it. So they thought, I saw in the news also that here locally they made preparations for the ancillary facility if needed over at the Mountain America Center. And has there been any discussion about just taking the COVID patients and directing them initially instead of having them go to the hospitals directly with the chance of infection of the staff at the hospital and just the facilities in general?
Sure. So at this point, the Mount America Expo Center is going to be for overflow of non-COVID patients. And that's because we believe we can best treat our COVID patients in a healthcare setting for those who need that hospital level of care. And we also currently have enough PPE for all of our healthcare providers to be able to provide that care safely. So at this point in Utah's outbreak, we are going to send COVID-19 patients who need hospitalization actually to the hospitals and transfer potentially, if we need the overflow, Mountain America will be available for those patients who are not COVID and can be in kind of an alternate setting and still get the care they need.
Hi, yeah. Can you explain to me how you track down the people a person has come in contact with, specifically with missionaries? You know, in the last couple of weeks, we've seen thousands coming home, and as of March 30th, the church reported 2 missionaries tested positive with the virus. So, what can you say about that? How are you tracking down the people those individuals have come in contact with?
Sure. So, whenever a Utahn tests positive for COVID-19, it's required by law to be immediately reported to the health department. Our health department case investigators contact that patient, and we go through a calendar of from 2 days before their symptoms started till the present day and talk through with them everything that happened in the day. And we identify those people who have come into close contact with them, and we get their contact information and reach out to them. This is a standard public health practice. We have very skilled contact investigators who have worked on these sorts of investigations for diseases beyond COVID-19. And so they're very skilled at being able to help people remember who they came into contact with and what they did during their day in order to be able to adequately and accurately identify all their close contacts.
Hi, Dr. Dunn. I read that Governor Gavin Newsom was actually sending ventilators to the national stockpile, even though they're expecting their peak in, I don't know, a week or more. And I was wondering if we're going to do the same, what our status on ventilators is. And then one other random question that I've kind of been wondering, is one gender seeming to get COVID-19 more than the other? I don't know if there's anything to read into that, but that's one question I hadn't heard asked before. I know we've talked about age and previous health conditions. I wondered if you're seeing any data that makes any sense or is worth even talking about as far as what gender might be getting it more.
Sure. So with the ventilator supply, we are currently getting counts from all of our healthcare systems. Not all of them have reported comprehensively to us about their ventilator supply, but we are working towards getting that exact number. The decision of whether or not to provide ventilators to the SNS will be, the Strategic National Stockpile, will be a decision made by our unified command in conjunction with the governor's office. So our first step is, of course, to get that comprehensive picture of what Utah's supply is and then what Utah's need will potentially be. With regards to gender, so the data coming out of China shows that more males were getting COVID-19 than females. In Utah, we are showing a little bit of a higher predisposition to males, but it's not statistically significant to draw any conclusions at this point in the outbreak.
Hi, I had another question about testing. In the data that the department released today, it looks like it accounts for about 1,200 more tests than yesterday. In previous days, we've seen more like 2,000 and 3,000. Is it just the swabs that is the reason for the decline in the numbers of tests reported today? Is it lower demand? Can you tell us, because it was a pretty sharp decline?
Yeah, so we've kind of seen this a little bit throughout the outbreak. Mondays and Tuesdays show a little bit of a dip in our testing, and that's because we have this lag in the negative test results coming towards us. And we also are seeing the less demand over the weekend. So it's a combination of potentially less demand from the weekend and then also a 3-day lag in the negative tests coming in. And so we'll potentially see an uptick Wednesday, Thursday, and Friday of this week. So we'll watch out for that. Okay, thank you guys so much.